Hello, I'm Dr. Konsaktan Paget. Today I'll be talking about COVID-19 impact on humanity. It's been over a year since the world gone viral. Basically, the world has been infected by this virus at 120 million today, March 14, 2021. In the United States, there were 30 million people got infected, with over half a million people died. Started in Wuhan, population 11 million. Started on December 1st, 2019. There was a man in his 70s fell ill, admitted Wuhan Central Hospital. Subsequently, by December 11, there were about 200 cases, and two-thirds of them are related to. They have visited this Wuhan, Huanan wet market where they sell fresh meat and live animals. By Christmas Eve, December 24, 2019, there were several viral pneumonia admitted to Wuhan Central Hospital, and the doctor took sample from the airway of one of the patients and sent to Vision Medicals 500 miles away. And 2 days later, a technician from that lab discovered short genetic sequence of the virus. Report to her boss, and it has to be confirmed. She posted online, and that she found 4 short strands of showing bad SARS-like coronavirus, and Dr. Ling Fa at National University of Singapore, related to Duke University, spot that on online and thought this is very big, another big outbreak coming on. And then those messages posted online were taken down. December 26, 2019. Basically, virus infectious agent of small size, simple composition. They cannot survive outside a host. So have to be a host in a living cell of animals, plant, or bacteria. The word simply means slimy liquid or poison. It's known that coronavirus live in bats, and it doesn't kill the bats, but human being doesn't come in contact with the bat, so it need intermediary animals, could be dog, cats, or camel, and so on. So it turned out like SARS, severe acute respiratory syndrome, back in 2002 in China. There was outbreak for about 8 months, and it spread out China as well. There were 800 deaths. Subsequently, China came out and apologized that there was 5 months of cover-up, until later on they disclosed that. The bats infected civet cats, and then to human. And then MERS, back in 2012, the bat virus infected camel and passed on to human being. In the Middle East, called MERS, Middle East Respiratory Syndrome related coronavirus, MERS-CoV. There were 2,500 cases in January of 2021. 45 new cases in 2020, about 39% death, with 866 deaths so far in 2020. There were large outbreak in Korea and Saudi Arabia in 2015, 2018. Still ongoing. Back to Wuhan. there's been a lot of talk on internet, online about new SARS-like virus starting. Talk about in medical community, and on December 30th there were about 4,000 cases. People got infected. Dr. Lee, ophthalmologist, he wrote a note on WeChat online warning his peers, his friend and family, that there's a new coronavirus. They try to identify the virus type and don't circulate information outside the group. But the government caught on and barred him from releasing information to the public, and he had to retract his statement as well. Subsequently, he died, unfortunately. And then all the keywords were taken down from the internet or online. They all disappeared. By December 30th, 2019, day 30th, day 30, there has been known online among medical community that there was new virus, about 20% different than SARS, to SARS. And Dr. George Gao was head of CDC there, was nowhere to be found. People tried to contact him on December 31st, 2000, on the New Year's Eve, 2019. But he called a contact virologist, Ian Lipkin, in New York, and confirmed that it's a new virus, but he stated that it's not highly transmissible. But Dr. Lipkin thought that was a mistake not to disclose the virus sequence to the public or to the world so that they can deal with it properly. By January 3rd, the government, there were official report of 44 cases of this new viral pneumonia. The government sent National Health Commission, now sent a team of scientists to investigate this new virus. And one of them is Dr. Sheng, from well-renowned virologist in Shanghai. He has been working with Professor Eddie Holmes on other viral respiratory disease. They were working closely together in the past before this happened. So around 2 a.m. of January 5th, he had a breakthrough. Dr. Sheng Dr. Sheng obtained a full genetic sequence of this new virus. And 4 other Chinese labs also obtained the whole sequence as well. But 2 days earlier, the National Health Commission has sent out a letter barring anyone to release such information. So not allowed to release the viral sequence. But 6 days later, on January 11, 2020, on public television, there was an announcement that the lab test confirmed that detect a novel coronavirus. So Professor Holmes from Australia thought that we cannot hold on to information. It has to be released to the public. So we talked to Professor Zhang Zhongchen, and then he agreed to that and sent the whole viral sequence to Professor Holmes, and he contacted Professor Rambout in England and send the whole viral sequence, and it's been posted on Virological online, and the world come to know viral sequence. So this forced the Chinese CDC to release the viral sequence, of the coronavirus, release to the public the whole sequence in a few hours later. And Dr. Zhang's lab was also closed temporarily. WHO then learned the whole sequence of this new virus January 11, 2020. And information was shared internationally, and 2 days later, the German scientists came out with a published a test kit to check for this virus in patients that come in with viral pneumonia. Basically, SARS is a coronary virus disease of 2019, the year of the outbreak. SARS is caused by SARS-CoV-2, or severe acute respiratory syndrome coronavirus 2. It's a single-strand RNA virus. RNA is encased in this viral envelope and had the spikes, and as shown on this enlarged diagram with the binding site. Basically, this SARS-CoV-2 virus would enter via the body via ACE2 receptor. The ACE2 receptor is found in type 2 pneumocytes in the air sacs of the lungs, and also on the endothelial cells or lining of the blood vessels. Basically, these are the ACE receptor available in the body. They're minor sites in the lung, but it's have direct access through the inhalation. They're present in a high frequency in the kidney and the small intestine, moderate amount in the large intestine, also high in the testicle. So that's why a lot of nausea, vomiting, and diarrhea. It's in the brain. There may be some as well. That's why they cause anosmia, loss of smell and taste, a goose ear. Basically, the virus a receptor site start with transmembrane protease serine 2 cleave off the ACE2 receptor, also activate the spike protein on the virus, then come in, attach to the receptor ACE2 receptor, angiotensin converting enzyme 2 receptor, and enter the cells and infect the person. Cause symptoms, most people have common symptoms, just fever, dry cough, and fatigue. Uncommon headache, nasal congestion, sore throat, cough of sputum, shortness of breath, pain in muscle and joint, chills, nausea, vomiting, diarrhea. Severe case has high fever, coughing up blood, decreased white cell, and kidney failure. Clinical cause, the first 2 weeks of viral phase. Second week, it can have the cytokine storm that you heard about. They're very sick from the autoimmune system being activated. In the third week, a coagulation phase. They may have I lost one of my friend from recurrent stroke and pulmonary emboli, massive emboli, pulmonary emboli, or blood clot in the lungs can kill him. And late phase, hyperinflammatory phase like chronic fatigue syndrome, severe muscle pain, and so on. About 20 to 30% of the patient require admission to the ICU, and about up to 40% did not survive, so there are a lot of death, basically. Treatment, basically, the convalescent plasma, people that previously infected, we transfuse the plasma from those people that have antibodies, can cure the patient. or remdesivir antiviral, which shortened the course by 5 days, similar to favipiravir in Japan and Asia. Also had very good result. And IL-6 inhibitor to treat a cytokine storm like Actemra or Salamedrol or steroid in acute inflammatory phase, and anticoagulant in case that have clotting, and hydroxychloroquine doesn't work for prevention but may work in some severe cases in ICU. There are also infusion of monoclonal antibodies, like Lilly has single monoclonal, Regeneron has combination of 2 monoclonal antibodies, or the MAPs. This is the one that President Trump got. There are several infusion centers in St. Louis now has this available, or through the Barnes Jewish Christian Hospitals, BJC system. The diagnosis, you can get study for PCR from nasal swab, nasopharyngeal swab, through the bronchial alveolar lavage, bronchial secretion, or through viral isolation through the respiratory tract, as well as stool, and then later with the blood test. In terms of guideline on pandemic, you have to test to make a diagnosis, and then treat and prevention. So from China, a lot of tourists from China would come to Thailand as the top destinations. And by January 8th, the first case of Chinese 61-year-old female has been found to have COVID. Since January 2nd, 2020, public health specialists in Thailand, they didn't believe the Chinese, believe what they stating that there's no human-to-human transmission. They thought if you have viral pneumonia, it means respiratory spreading and very likely human-to-human spreading. And on January 8th, there were 4 short strain of new coronavirus was found, and subsequently confirmed after the Chinese released the viral sequence on this, confirmed by January 13 as the first case outside of China. As it turned out, this has been successful because in terms of epidemiologists, there are 183 all over Thailand, especially in Bangkok. And people there are cooperative. They also fine people who doesn't wear masks about $30. Healthcare and public health working together. There were 1 million volunteers around the country to try to track down cases, like if people have symptoms, make a diagnosis. They also make a short, quick diagnosis with the CRISPR technique, with the Cas9 technique. Can tell a result in 15 minutes and can read it with naked eye. They're also tracking index case and prevent transmission to other people. So very successful epidemiology, which is a 40-year history in Thailand. So at the same time, there are several cases that went out, like Korea, also same day on January 8th. Took them about 12 days to confirm. Singapore on the January 10, confirmed by January 23rd. And the WHO announced this is a pandemic on March 11, so it's an anniversary, of a year anniversary on March 11 this year. By first 100 days, there were several deaths, over 1.4. There were several cases, over 1.4 million around the world. There were a lot in Europe, North America, South America, as well as Africa and Australia as well. So what went wrong on this COVID-19 pandemic? Larry Wright of the New Yorker wrote, investigated and found out that public health here are totally separate from the healthcare. Like CDC is separate. So USA is the only country in the world that do this. Other country, they kind of work together as one unit. And initially they said masks was not necessary because afraid of they don't have enough N95 masks. Even the Chinese doctor warned about a mistake about not to wear masks. And this became mixed message up until present time, and become political issue as well. As one of my patients said, first they told you not to wear a mask, and then they said you need to wear a mask. Now they said you wear a double layer, 2 layers of it. So I'm confused, so I'm not going to wear it. So it become political issue. In the PPE, personal protective equipment, government said they will back them up, but when come to request for more PPE, each state has to file on their own. So become, instead of one United States of America pandemic, become 50 states pandemic. And CDC, Robert Redfield, head of CDC, talked to the head of CDC, Josh Gao, on January 3rd, and said there's no minimal human-to-human transmission. And CDC doesn't try to make their own kit instead of buying from the WHO. So they waste 2 months because the first test kit came out was a flop. It doesn't work. It's many false negative. And they waste another month to try to remake it. So not trusting other manufacturers outside of the United States. So by first 100 days, we have almost 2,700 deaths already. And strict masking, social distancing, and testing are very important. And United States failed to do that. Each state has their own mandatory system. So several states are very loose. Comparing to the Australia, South Korea, New Zealand, Singapore, they're very tight on strict measure on those, and they were able to control the cases. A lot of 500,000 people in the United States die. So wearing masks is important. It's also an act of mindful awareness, not to contract this illness, as well as an act of loving kindness towards other people as well. You can wear all sorts of masks. Doesn't have to be. It's shown like by coughing or loud talking, there were droplets that can travel up to 12 feet. Sometimes small droplet can travel to 20 feet. And wearing masks help to confine the area to in front of your face. And in singing or loud talking can also contract this small particle, so it can go farther out and stay in the air for hours. Like in case of in Washington State, there was one case that infected 52 out of 60 people, so about 87% infection rate on March 10. So it can spread easily, so we have to avoid groups and stay at least 6 feet apart and wear face covering. Another outbreak was in Atlanta, in Georgia, in Georgia's summer camp, in 344 children there. 75.6% got infected a week later. Basically, children, half of them, over half got infected. Teenager, 44%, and about a third in adult, as well as in the staffer. So, social distancing is important. They're talking about R0, about 2.5, that 1% can infect 2.5%. But in those cases, as I mentioned, can be almost 90, almost 9, and 75 to 87%. And about 35% asymptomatic, so you don't know who has the virus. Another problem that exists back in March 2020 was that it was public health malpractice, more or less, because there were 200 U.S. citizens that came back from Costa Rica, Luminosa cruise ship, fell ill while they're flying back to Atlanta, home of the CDC, after reaching Europe. And nothing was done. They let them go. Several of them, of the 200 passengers from the cruise ship passenger, was sick with nausea, vomiting, high fever, muscle, body ache, pain, and one of them collapsed on the plane. And CDC was asked what to do, and then they let people flew back to 17 states and Canada. They cleared them to travel. One of them died. They don't want to collapse in the plane. This couple also got infected later on when they tested after they arrived home. And another one or two couples also got infected. And Dr. Alec Khan, Dean of U of Nebraska, said this is public health malpractice. And COVID has become the third leading cause of death after heart disease and cancer. And we've been enjoying decreased mortality for many years, but in 2020, with the COVID, we lost that. In fact, we shortened lifespan by 1.13 years, out of like 77.8 previously years on average. And also another issue was the SARS-CoV-2 variants, like in Pacific Rim and in Myanmar. The D614 have been mutated into G614 with more infectious prevalent in the population. Also in Great Britain there are B117, which is more infectious. In South Africa there's B1351, which is also more patients are more sicker as well. And these are the three mutant strain of the B1351 shown on the bottom. They're more highly resistant because they escape antibodies and neutralizing humoral antibodies that come to get rid of them. They escape that. And these are the structure on the electron microscopy in the 3D structure of the British B117, and this is the South Africa one, B1351, and this is the Brazil one, the P1 virus, with several sites being mutated. Basically, the lack of the double check system that normally they would have, so they go wild in mutating at the risk of they may be destroyed by the host, but also they also may be more harmful as well. And the recent insight into this infectivity is that I mentioned earlier, D614 have been converted more into the G614, the new mutant strain, more infectious. And they also may have to do with heparin sulfate, may bind to the spike protein, make them anchor to the receptor, AS2 receptor, and enter the cell easier, and came out with more viral spreading. And basically, the spike protein, the mRNA, has been used to make vaccine through this Dr. MD PhD Barney Graham has been working on this mRNA protein for 12 years, working on Ebola and HIV previously. And the technology is there that can be used instead of the whole virus. They use the mRNA as to make vaccine to avoid infection. So this is the Oxford AstraZeneca vaccine. They use chimp virus, which doesn't harm them, doesn't kill them. It's a mild cold virus, a chimp adenovirus at Oxford. A kind of like use it, put mRNA in there, in the virus as an envelope, and use it to make vaccine to inject people, and stimulate a T cell and antibody response to the spike protein, the mRNA. All the vaccine are mRNA for the spike protein. So then the next time, and when the body sees this virus with the spike protein, they will kind of like block it and nullify that virus, like you have a shield protecting against this virus. The other technology is use mRNA vaccine, but use lipid nanoparticle as an envelope for this mRNA, and then pegylate it to make it more immunogenic, and inject like Moderna and Pfizer use this technique. AstraZeneca use the chimp adenovirus as a vehicle to make vaccine. Janssen use human adenovirus vaccine. And basically, vaccine has been produced by many companies. In Thailand, they use AstraZeneca, and with the transfer technology, they start immunizing, they start vaccinating since February, and by May they will have transfer technology to the local biological lab there, immunology tech unit over there to make transfer technology to make their own vaccine. Also, this Moderna and Pfizer. This need 2 shots, but AstraZeneca only need 1 shot, and you can just keep in regular refrigerator. Pfizer need minus 70 degree freezer to keep the vaccine and thaw it out 24 hours earlier before vaccination. Moderna used just about this regular refrigerator to keep the vaccines. They need about minus 30 degrees. And in the lower middle income country, AstraZeneca has been working with them. Most of the richer country have acquired Moderna and Pfizer's vaccine. But AstraZeneca has vaccine has come to America now, and there are some that have a COVAX. So like Sanofi and AstraZeneca work on that. We'll talk about that. We need about 70 to 80% of herd immunity. Need that to stop the COVID-19. About 40% of people said they don't want any vaccination. So the virus may continue to spread if there's not enough people to reach 80%. So become an issue of the vaccine nationalism. If the virus COVID-19 is still ongoing, not under control, it will cost the world 1.4 trillion per year. And will cost them to keep vaccinating at 119 billion a year, while they're supplying to the low-income countries. It would cost them only 25 billion to try to get the herd immunity up. So they started COVAX kind of cooperative to help the poorer country. Food bank has become important because people double the amount of food insecurity from 40% to 28% during this COVID time. And about 17% of restaurants closing permanently, top at 110,000 restaurants closed. Also deprive the kids from learning from 44% with additional 10% more during this COVID, and to learn from home online. And a lot of people got laid off, lost their job, especially in Hispanic and Black. At least 40% of about every family, now to 24% has people that lost their job and have to use their saving income or borrow money to survive, have trouble paying bills or mortgage. So renting become a difficult problem. They're more homeless, but the housing market went up 24% because the mortgage interest rate was so low at 2.5 to 3%, and the house price cost went up at least 13%. GDP dropped on forecast, and before COVID, U.S. had national debt of $23.3 trillion, February 2020. After COVID, national debt went up to 27 trillion, 27.5 trillion. This doesn't include another 1.9 trillion stimulus, which came out this past Friday on March 12, 2021. So we end up with about $29 trillion after this. Okay, that's the end of my talk. Thank you for your attention.